Hey guys, Dr. McDonald. Going to go over the heart anatomy. I'm going right down the list, depending on which screen that we're on. So I will have everything on the heart list. So if you're looking on the lab list under heart anatomy, let's go ahead and keep going down. Okay, the first thing that I've got on here is the apex. The apex of the heart is actually kind of the bottom right here. It's just that little area, the pointed side. Next thing we have is the arch of the aorta, or aortic arch. It's right here. Now the aorta is kind of divided into different parts. It's the same vessel. This part that comes off the heart and goes up is called the ascending aorta. This part where it's right at the top is called the aortic arch. Now the base of, the descending aorta I have on a different PowerPoint, and I'll show it to you. As a matter of fact, it's actually with the blood vessels. Now just to let you know guys, they repeat, for whatever reason, they have put the same blood vessels on that we're doing here in the heart on the blood vessels. I'm not redoing it. I'm just doing the aorta and all these guys once with the heart. So don't worry about it. I don't know why they duplicated it, but they did. Okay, as far as the base, can't really see it on this one. The base is this part right here. So the apex is the pointed side. This side is the base. But I'll show it to you on a different PowerPoint where it's actually marked. Okay, let me come on down till I find. Okay, the vena cava. So this is superior vena cava. It's on the top, and the inferior is on the bottom. Now these guys right here that you see, these flaps, these things are called the auricles. So we have one on the left side and one on the right side. They're over the top of the atrium, and we'll see the atrium here in a better place. Okay, pulmonary veins, these are right here. There's 4 of them. There's 2 on the left and 2 on the right. Those are the pulmonary veins, but I'll show them to you on I have another diagram that has the posterior part of the heart, and you can look at from there too. Okay, again, I know this one says right atrium. Underneath the auricle is the right atrium. How are you going to know which one I want on an exam? I'm going to accept either answer. That's how. Left atrium, this is the auricle. The left atrium is right there, and I'm going to show it to you when we get to the anatomy of the inside of the heart. You can see this a lot better. Now if I'm showing you a picture of the atrium, left or right, that's inside the heart, then you cannot use auricle. You need to use atrium. I'll tell you more about that when we get to that. Okay, pulmonary trunk is right here. This is the main blood vessel that leaves the right part of the heart to go to the lungs. It goes and then it splits into 2, one to the left and one to the right. That's because you've got lungs on both sides of the heart. So it comes up and then it goes. So those are that's the pulmonary trunk. And then the pulmonary arteries are going to be these guys right here. Now guys, see if I can make that go away. Guys, this is something that's different in the heart. Most people just memorize that. Red vessels are arteries and blue vessels are veins. In the heart, it's exactly different. The actual definition of artery and vein: artery is a blood vessel that leaves the heart. A vein is a vessel that comes to the heart. So these left and right pulmonary veins are coming back to the heart from the lungs. I don't want you to get tripped up on that. Now underneath the atria you have the 2 ventricles, one on the right and one on the left. Let's see, guys. See what else we can see on here. Left coronary artery. It's hard to see. Underneath the left auricle right here is the left coronary artery. It splits into two. I mean, just right there you can see the branching. This one that goes down is the anterior intraventricular artery. This one that's going around toward the back of the heart is the circumflex artery. And by the way, these guys, these are the prime areas that we see heart attacks occurring in when these arteries get blocked. Okay, let's keep going. The great cardiac vein is going to be down there with the anterior interventricular artery. They call it interventriculars because it's between the two ventricles. It's on the surface. There's a little U-shaped indention right here, and these blood vessels sit in it. Here's the right ventricle, and there's the left ventricle. See, guys. Marginal artery is right here. I guess we'll just go ahead and talk about the right coronary. This is the left, the right coronary artery is right there. Coming off of the right coronary artery at an angle, going back down the side of the right ventricle, is going to be the marginal artery. We definitely want to have that one down pat. All of these are going to be fair game for your quiz and your exam, your midterm exam. So you need to know where all this stuff is. Okay, let me look on the list. Now guys, there's more things labeled here than are on your lab list. What does that mean? It means don't worry about it unless it's on your lab list. Don't spend your time, your precious limited amount of time, learning something that you're not going to be quizzed on. I mean, it's a great thing to know. I'm all for that, but right now I'm all for you guys doing well in the class and getting the good grade. Okay? I think there's just one more thing on here. This right here, the ligamentum arteriosum, this is on your lab list. This guy used to be a blood vessel, and it's kind of got obliterated, and now it's nothing but a ligament that's connecting the pulmonary trunk to the aorta. But you need to know that. See, there's things. The anterior cardiac vein is not on your lab list, so I really think you should probably just let it go. Okay, guys, let's posterior. You're looking at the heart from the back. Again, that base, there it is. There is the aortic arch. Those are the two pulmonary arteries. Those are the four pulmonary veins coming back. So let's go to the part that's directly involved in your lab list. The great cardiac vein, we already saw that. It was going down into the anterior interventricular artery, also comes around. Posterior vein, right there, I believe. Yep. Nope. Yeah, it is. Posterior cardiac vein is on your lab list. It's going to be a branch off of here. Let me make sure. I'm checking your lab list to make sure I don't leave anything out. Okay. The left ventricle, the right ventricle, we've seen that before. That's the left atrium, the right atrium. You're going to be able to see that better. Those are also the auricles. The apex, the middle cardiac vein, we do have that. Yep. The middle cardiac vein is going to be right here. it's going to run next to the posterior interventricular artery, which is also sitting in a sulcus. So we got middle cardiac, we got the posterior, I think that's every sinus. Here, it's the great cardiac vein kind of bulges out, and it becomes an area called the coronary sinus. This is a place for the blood to drain in order to get it back into the inferior vena cava and back to the heart. This is the deoxygenated blood from the heart itself. And I missed one, guys. The small cardiac vein right here with the marginal artery is on your lab list. Make sure I don't leave anything out. Now all these are posted on under your study resources, so it's there for you. The right coronary artery, just looking at it from the back. Other than that, we've got everything on there. Now inside, this is where this area right in here is going to be the right atrium. It is not going to be the right auricle. The same thing for the left atrium over here. If this is labeled, it's only going to be an atrium. It's not going to be an auricle. These are the ventricles, the right ventricle and the left ventricle. Now, between the right atrium and the right ventricle, there's a valve that shuts to keep blood from flowing back in there. That valve is called the tricuspid valve. It's on the right side. On the left side, we have the bicuspid valve. You can also call it a mitral valve because that's a bona fide variation. And again, these valves allow blood to go from the atrium into the ventricles. When the ventricles are getting ready to squeeze the blood out to where it's going, they will shut these valves so that the blood can't flow back in there. Those two valves are called the atrioventricular valves, AV valves, because they're between the atria and the ventricles, which makes kind of sense to me. Now, blood comes through here into the ventricle. Blood leaves the ventricle through the semilunar valves, and you have two of those. The one on the right is simply called the pulmonary valve. The one on the left is called the aortic valve because it opens up into the aorta. Now, right here, if you look at these valves, you can see these fibrous connections from the valve down to these kind of cone-shaped objects right there. Those strings, those are heartstrings. You heard the phrase, "You're really playing on my heartstrings." But we don't call them heartstrings. They are chordae tendineae. You need to be able to spell it. That's a booger, so you better spend some time with it. These guys that they attach to are called papillary muscles. Okay, let's see what else. The pectinate muscles, I think they're on there. Let me make sure, guys. Yep, pectinate muscles. The pectinate muscles are going to be up here in the atria. Okay, the last thing is the foramen ovale. It's right here. Remember I told you about the ductus arteriosus, which is also called a ligamentum arteriosum. Before people are born, the blood between the arteries and the veins connects. You have anastomosis. Don't want to go into that. That's for the lecture. But this is a hole that allowed blood to come from here and then go into the left side of the heart. You may have heard of people babies born with a hole in their heart, this is what they're talking about. As soon as you're born, as soon as you take that first breath of actual air, this closes. But that's the name of it. It's foramen ovale. That is fossa ovalis. You can call it either one. Technically, it's really a fossa rather than a foramen. If you guys remember, a foramen is a hole. A fossa is just a bowl-shaped. But either one of those will be sufficient for our purposes. Let's see, it's trabeculae. Yep, they're on there. Here in the ventricles, remember we talked about pectinate muscles. Now this is not including the papillary muscles, but this is the trabeculae carnii. That is on your lab list, guys. You got to know that. This area, this muscular area that separates the right and the left ventricles is called the interventricular septum. You got to know that too. Okay, the layers of the heart. Here on the inside, you've got epithelial tissue. This epithelial tissue is exactly the same as it is in the blood vessels. It's like endocardium or endothelium, but since it's in the heart, we call it endocardium. It's just an thin epithelial layer that lines the inside of the heart. Okay, on the outside of the heart, you have connective tissue. That is called the epicardium. That is exactly the same thing. The epicardium is the same as the visceral pericardium. Remember the serosa from A&P1? You have a parietal serosa that lines the cavity and a visceral serosa that's on the organ. We talked about that for the abdomen and for the lungs. Well, we talked about the visceral epicardium, or the visceral pericardium, sorry. But we call it the same thing. It's the epicardium. It's exactly the same. So will I give credit for either answer? Sure will. Now between the endocardium and the epicardium, you've got this big thick layer, and this is cardiac muscle tissue. So it is the myocardium. I don't think I told you guys about the coronary sulcus. I'll have to go back and do that one. I think that's pretty much it. Let me go back. Coronary sulcus. The coronary sulcus is this area right here. You see where the great vein and the circumflex artery sits. It's like a groove between the atria and the ventricles. That is the coronary sulcus. I know it's not labeled there, but I'm telling you now, so still fair game. Okay guys, we've only got two things left on the heart, and that's going to be the pericardial sac and the pericardial cavity. The pericardial cavity is just a space. It's a hole between these two lungs here. We have mediastinum. Mediastinum is this whole space is mediastinum. This particular space is the pericardial cavity. That's from A&P1, so I don't have a lot of difficulty with it. This part up here, which is not on your lab list, is the superior. Now, as far as the pericardial sac is nothing but the serosa. It's the visceral and parietal epicardium that forms a little sac around the heart. And that's everything on the heart, guys. So we're good on this. I've gone through everything on there that's on your lab list, so you should be ready. Alright guys, that's got it for this one, and I'll see you in the next one.